hey, measurement of growth always bothers you when it comes to height, weight, head circumference, mid-arm circumference, or the chest circumference. You are always lost with the numbers, and formula always disturb you. You are not able to answer the questions from this part of the growth. Then I have made it very simple for you. My tables, my formulas are so simple, you are going to remember it in no time. So let's start learning. Hi, I am Dr. Triyavirani Malde, pediatrician and consultant neonatologist, and I'll be your guide for pediatric subject. Please do subscribe my channel because lot is going to happen on this channel for pediatrics, and give like to this video. For the ease of understanding, again I have divided this part 2 in a few parts. The part 1 will be assessment of the growth, part 2 will be the normal growth pattern, part 3 will be growth velocity, part 4 will be growth monitoring, and the few words on the growth chart. So let's start with the part 1, that is assessment of the growth. A very important thing for you to remember, that how do we assess the physical growth? It is in the form of weight, length, head circumference, mid-arm circumference, chest circumference, as well as last but not the least, skin fold thickness. So let's start with first parameter, that is weight. If you are just seeing at the multiple choice question, I would suggest that please do consider the other situation also. As a pediatrician, not only pediatrician, as a general medical practitioner, you should know that how the weight is going to get measured, how we are measuring the weight, how the weight is going to get increment. So as a general person, if some family members comes and asks that my child is this year old, this many years old, this weight is normal, it is very a common thing, and you would be expected to answer those questions. So I suggest that just not as a purpose of multiple choice question. It is very important for you as a medical person. Like after a few years, when you yourself will become parent, you should know that how this all parameters improve, or how this parameter will get increment. So I do suggest that please, not as a purpose of exam, for a general knowledge also, you should know all these kind of things. So first is weight. How we are going to measure the weight? First and foremost, initially it was a beam balance. When I was born, it was a kind of beam balance and the spring balance was there. But nowadays we have everywhere, it is a digital world. So we are having electronic type of weighing scale. This is a bucket weighing scale. Very small babies are getting measured. Here the capacity will be around 20 kg and the variation will be 5 to 10 grams. When this is a very a big weighing machine, digital type of weighing machine, it is also used in industries, but these are the standing weighing machine for the big babies who can stand, and this is the combo of both. You can use this as both the things. If the baby is small, could be placed here, and if it can stand, could be placed here. So how we are going to measure the weight of the child? A very important thing, child should wear minimum and light clothing. Just have an example that if you are weighing the child one day today with jeans on, and the next day a normal pair of clothing, then what will happen? Today the weight will be more and the next day the weight will be less, and it will give you a false impression that the child has lost this much of weight. This is particularly applicable when we are dealing with the child who is having diarrhea. If the baby is having a diarrhea and you are suspecting it could be a dehydration, if the variation of the weight is this much, we may think that it is more than 10% and we may consider it as a severe dehydration. So this is very important that it should be minimum and it should be light, not a jacket and the mufflers and shawl and sweater should be put on when we are weighing the child. We can always request the parents to remove all kind of excess clothes. Only child should be weighed in a minimum clothing. Place the child in the middle of the weighing pan, otherwise what will happen? The child will either fall off the weighing pan or the weight will not be appropriate and accurate. And before starting a weighing of child, we should correct it for the 0. Now the next thing, length. So what is difference between length and height? Length is sleeping, when the child is supine, because when you are dealing with the pediatric patient, they do not start standing very right from the birth. You cannot ask baby to stand. So this is for the babies who cannot stand, and this is applicable particularly less than 2 years of the child. What is the difference between height and the length? When we are taking a length, it is supine, right? And we are taking the height, it is standing. When someone is standing, the gravitational force of course is going to work, and the height will be always lesser than the length because of gravitational force working on the spinal cord. So vertebral bodies. So less than 2 years we are taking a height. What is the tool for taking a height? It is Anthropometry, which is shown in the picture. And this end is fixed. This is for the head, and this is flexible foot bar, which can move forward also and backward also. And how we are going to measure it? First and foremost method is the hairpins or the braid should be removed, otherwise it will give false height. The head is firmly fixed in a position against the upright headboard, and then we have to flex the knees like she has flexed here. Excuse me. And feet should be at the right angle to the legs, like the feet should be at right angles to the leg, and toes should point upward. Here we should take the height. If you take the height, like if you do not do all this thing, you may have a false reduced or false increased in the height, in the length. So this is the exact method we should do it. And if you are having your ward posting, I suggest that please do go into the ward, use this Anthropometry and take length of few babies. Free foot board is brought into firm contact with the child's heel. We have to keep in touch with the child's heel here. So again a trivia time. What is this instrument used for? Your options are A, measure weight, B, measure length, C, measure head circumference, and D, measure skin fold thickness. Now after the length, we are going to learn about height. Height is applicable after the 2 years of age. And what is the tool we are using? It is called stadiometer. This instrument is called stadiometer, which is used for the measurement of the height. What is the method? The child should stand upright, heel should be separated, and weight to be borne evenly on the both feet. It should be on both feet. There should not be here and there, otherwise height would be lesser or more than the normal. What else we have to take care? The child's heel, buttocks, shoulder blades, and the back of the head should be in firm contact with the stadiometer. You can see this thing. So these are the body part which should be in alignment when we are taking the height. Now something about head part. If you are taking the height, then you should know the Frankfurt plane. What is Frankfurt plane? It is a line joining external auditory meatus and the lower margin of the orbit. If you join these two lines, biauricular plane, then it is called Frankfurt plane. It should be in a horizontal plane. So external auditory meatus, lower margin of the orbit, and biauricular plane should be horizontal while measuring the height, like this. And then headpiece should firmly placed on the head to press the hair. Now we have to take into consideration this number for measuring a height. Now the third parameter is head circumference. How we are going to measure the head circumference? With the non-stretchable measuring tape. What is the method? It is called cross-step method. And how we are going to take it? It is between the occipital protuberance and supraorbital ridges. The head circumference is taken between the supraorbital ridges and the occipital protuberance, and it is called cross-step method. Now mid-arm circumference. Again it is taken with the same tool, that is non-stretchable measuring tape. What is the method? First we have to measure the midpoint of the left upper arm. How we are going to measure it? We have to take the tip of the acromion process and the process of scapula and the olecranon of ulna. We have to take a midpoint. Suppose this is around 20 centimeter, then my midpoint will be somewhere here at 10 centimeter. And then we have to take it by cross step method like this. So first of all, in the left hand we have to take a midpoint of these two processes, and then we have to take a measure it. We have to make sure that it's just tight enough to avoid gaps, and it should not compress soft tissues. So this is for mid-arm circumference. We have discussed weight, length, height, head circumference and mid-arm circumference. Now we are going to discuss. So here is one more equipment for measuring the mid-arm circumference. Particularly it is used for the community health workers, where she or he has to screen many children in a very small period of time. So this is Shakir's tape. It is color coded tape and it is for the community screening. It has three colors. The community health worker has to put the measure tape around, encircling the mid around the approximate part of the mid arm of the child, and whatever color is coming in between this box will be the options. If it is green, it is normal, more than 13.5. If it is yellow, it says it is moderate malnutrition, between the 12.5 to 13.5. If it is a red, it says it is severe malnutrition, it is less than 12.5 centimeter. So what is this equipment used for? Your options are A, measuring mid-arm circumference, B, measuring the height, C, measuring the head circumference, and D, measuring a skin fold thickness. Last part was skin fold thickness. How we are going to measure it? What is the tool used for it? It is hair pendant calipers. We have all seen in our physiology classes. This is the hair pendant caliper used for the measurement of skin fold. What are the area which has to be measured? Suprascapular, subscapular, bicep and tricep. And then values should be plotted, and then the chart has to be compared as per the centile. So this is question number 2, that what is this instrument used for? It is for measuring a weight, height, C, head circumference or skin fold thickness. I again request you that please do write in the comment box or in the copy, because we are going to have a discussion in the upcoming videos. It's a typo mistake. Question number 3, which of the following is not true in assessing the skin fold thickness? A, measured at the tricep level. B, measured at the nearest of 1 centimeter. Not true. Please do read the answer carefully. C, Tanner's chart contain the normal value. D, indirectly indicate the caloric reserve of the body. Now we have learned how we can measure the weight, height, head circumference, tool and methods. Now we are going to see the pattern, that how does this going to change with the age. First of all, we are going to learn about weight. If you take a weight, average Indian baby birth weight is 2.8. Remember this figure, 2.8 is the average newborn baby birth weight, Indian baby birth weight. However, for the first few days, the 10% of the body weight is lost. This is applicable for full-term newborn. It is not at all same for a preterm, because the preterm, the birth weight will be different. The rest of the laws are not applicable to the preterm babies. So please remember, this is only applicable for full-term child. And here we are losing 10% of the extracellular fluid. But, however, by 1 week or 10 days, the birth weight is again achieved. So for your remembering, we have to remember that 2.8 is a average Indian baby birth weight, and the birth weight is regained by the 10 days. So after 10 days, what are the rate of increment? From 10 days to 3 months, you have to remember 25 to 30 gram per day. Now first 3 months, 20 gram per day. Then 6 to 9 months, 15 gram per day. 9 to 12 months, 12 gram per day. 12 there is a 12 number here, so 12 gram for last 3 months you have to remember. Here it is 3 number, so 30 gram per day in first 3 months. So first 3 months 30, last 3 months 12. In between 3 to 6 it is 20 and 6 to 9 it is 15. Is it easy? Yes, it is easy. You can remember it. 30, 20, 15 and 12. But after that we have to also know the formula, that how this easily we can remember the weight according to the age. As I already told that this is also important for a general knowledge. If someone is asking you that this is the age of my child and this is the weight, is it normal? Then you can answer it confidently if you know all this formula. It is very easy, nothing much, it's not a rocket science, it's just you have to pay attention for only 2 to 3 minutes and you will be knowing all this in no time. It's my guarantee. So how we can calculate the expected? See, it is expected weight. If you are dealing with the 2-year-old child, you have to apply this formula and your answer will be here. Okay, so let's learn it now. It will give you a gross idea of the weight of the child. So if you are dealing with the child who is less than 1 year, then you have to apply this formula, x plus 9 divided by 2. X is in month. So if you are dealing with the child who is 8 months old, so 8 plus 9 divided by 2 will be around 8.5 kg. Got it? So if you are dealing with a child who is 1 year or maybe 11 months, then 11 plus 9 by 2, it means it is 20. 20 by 2, so it is 10 kg. So it will give you a rough idea. If you are dealing with the child who is between 1 to 6 years, then 2x plus 8 is a formula. X is in year here, right? So 2 into 2, like if you are dealing with the child who is 2-year-old, so 2 times 2 is 4 plus 8 is around 12 kg. So 2 years of the child, the ideal weight should be 12 kg. Okay. And if you are dealing with the child who is more than 6 years, 7 to 10 years, then your formula is 3 times age in years. So if you are dealing with the child who is 8 years of age, 8 into 3 will be 24 kg. So you have to remember 3 things. You are dealing less than 1 year, 1 to 6 year and 7 to 12 year. If it is less than 1 year, it is x plus 9 by 2. If it is 1 to 6 year, it is 2x plus 8. If it is more than 6 year, it is 3 times x. I hope you all will remember. You have to just store it somewhere in your gray matter and you will be having answer in no time. So for the ease of remembering, see, you have to remember this table also, that how does because I have seen so many times the questions are also asked from this. See, if at the birth we consider x as a birth weight, child will double the weight 2 times at around 5 months, 3 times at 1 year, 2 year 4 times, 7 years 7 times and 10 years 10 times. Don't get confused. See this graph. If you see this graph, at birth it is x. At 0.5, that is 5 to 6 months, it is 2x. At 1 year, it is 3x. At 2 year, it is 4x. You have to just keep on adding 1. At 3 year, it is 5x. 4 year, we will only remember the height, that is 100 centimeter. 5 year, it is 6x. 7 year, it is 7x. 10 year, it is 10x. So how we are going to remember it? At 1 year, at the time of birth, it is 1x. 5 months, it is 2x. 1 year, it is 3x. 2 year, it is 4x. 3 year, it is 5x. 5 year, it is 6x. After that, 7 and 10. 7 year, 7x. 10 year, 10x. So anyone who is born with the weight of 3 kg, we are expecting at 10 year, 10 into 3, 30 kg. Correct? Isn't it easy? Yeah, it is really easy. It's a matter of just a mind game. So question number 5. Birth weight doubles by, your options are A 3 months, B 5 months, C 9 months or it is D 12 months. Question number 6. Weight of the newborn quadruple by A 9 months, B 12 months, C 2 years or it is D 3 years. I suggest please do write in the comment box or in the copy. Question number 7. Infant body weight triple by age of A 5 months, B 11 months, C 2 years or it is D 18 months. Question number 8. Weight of the child at 3 years is usually this many times of birth weight. A 3, B 4, C 5, D 7. It's just a math game. If you remember the only one slide, you will be able to answer the question with no doubts. Confidently you can attempt all these questions. Now we should know that how much weight is gained. In a 1 year, the child will gain 6 kg per year. Between 2 to 6 years, it is 2 kg per year. And 6 years till puberty, it is 3 kg per year. So if you see, the growth velocity is maximum in a first year, in a terms of weight also, and we will learn that in terms of height also. Now the second part, we are going to learn about length. Okay, length and height. We have learned how the weight is getting increased in a child's life. Now we are going to learn how length is going to get increased in the child's life. So again, we'll start at the time of the birth. At birth, average Indian baby's length is 50 centimeter. Okay, at 3 months it is 60. At 9 months it is 70, and at 1 year 75. You can combine both the thing, what we have remembered for weight also. Similarly, you can remember this also. At birth the height is 50, 3 months 60, 9 months 70, and 1 year 75. Come to this part. At birth it is 50. Between birth to 3 months, the child will gain 10 centimeter of the height. At 3 months around 60 centimeter. Between 3 months to 9 months, it is again a child will grow by 10 centimeter. So by 9 months it is 70. And at 1 year or by the first birthday, the height of the baby, length of the baby will be 75 centimeter. You have to remember these 4 parameters: 50, 60, 70 and 75. Now if you see after the age of 1 year, what is happening? We have reached till 75 and growth velocity is 25 centimeter per year in first year of the life. If you see the second year, child will gain again 15 centimeter, here 25, then 15. So by the age of 2 years, child will be around 90 centimeter. Now 4 years, you have to remember this, pay attention over there. 4 year century. 4 year 100 centimeter. At around 4 years of life, child height is 100 centimeters. So child had a century for a height at 4 year of age, and between the 4 to 12 years, the child will grow around 6.5 centimeter per year, and by the 12 year, the height will be around 150. Okay. So you have to remember 2 or 3 things. 1 year 75, 2 year 90, 4 year 100, and then at 12 year it is 150. This is important. Again, at birth 50, 1 year 75, 2 year 90, 4 year 100. But for the ease of remembering, you can remember the which formula. 6x, x is in year, plus 77 is the height, expected height of the baby after the 2 year of the life. We know already 2 year around 90 centimeter. After that, you can calculate roughly this height. Now again trivia time. Question number 9. Normal gain in the length in a full term baby at first 6 months. It is first 6 months. Please remember, it is first 6 months. Your options are, here it is a full term and first 6 months, not 3 months. Okay. A 6 centimeter, B 9 centimeter, C 15, or it is a D 24. Now it is just again a revision of the previous slides, that by 1 year 25 centimeter per year, 12 centimeter, 2 to 5 6 centimeter, and 5 to 10 5 to 6 centimeter per year. Trivia time. Question number 10. Height of a child is double at the birth weight, at the birth weight of the birth height at the age of, sorry, it's a typing mistake, here it is a height, not the weight. At the age of A 1 year, B 2 year, C 3 year, or it's a D 4 year. Question number 11. Increase in the height in the first year by, it is given in the percentage, right? Again it's simple math. A 40 years, B 50 years, C 60 years, or it is a D 70 years. Get height. For ease of understanding, we also should know mid-parental height, because sometimes in OPD practice you are facing a child whose parents are short and they are much concerned about the child's height, that what kind of supplement should be given, what kind of things to be given, what exercise to be done to increase the height. But if you remember our first lecture, that is growth part 1, height, intelligent quotient and the head circumference is genetically depending on the parents. It's directly proportionate on the genetic pool of the parents. So you can always say that this is your height and your child's height is going to grow till this. So what is a mid-parental height? It is very simple. For girl, mother side plus father side minus 13 divided by 2. So it is minus 6.5. For boys, we have to just add it, mother side, father side plus 6.5. Okay. So question number 12. Average gain of length in the first year is A 25 cm, B 28 cm, C 50 cm, or else D it is 75 cm. Question number 13. A normal healthy child has height of 100 cm and weight of 16 kg. What is the most likely age? If you remember the formula of both the things, height and weight, you will be able to answer the question without confusion. Your options are A 3 years, B 4 years, C 5 years, or it is a D 6 years. Now we have learned about height and weight. Now we are going to learn about normal growth pattern of head circumference. It is very easy for us. Again, we will start with the newborn. Expected newborn Indian head circumference is between 33 to 35 centimeter. But sometimes what is happening, if you apply the formula, we need to have age with us. But sometimes we are facing the children who are not having a proper age. Parents are not knowing the age. At that time, we can apply this Dine's formula, that is head circumference is equal to length by 2 plus 9.5 plus or minus 2.5. So if we know the length of the child, we can say this head circumference is appropriate for the length if we do not know the age of the child, because rest all things are depending on the age. So if you see the rate of increment, if you see the normal head circumference, we all know that at the time of birth it is around 33 to 35, 3 months it is 40, 6 months it is 42 to 43, 1 year it is 45, 2 year it is 47 or 48, and 5 year it is 50. 5 year 50, 5 year 50, you can remember like this. 5 year 50, 1 year 45. We can remember like this, that at around 1 year child is having 45 and at around 5 year it is 50. I suggest you take your head circumference. Do you know your head circumference? It may be around 52 or 53. Just imagine that after 5 years the head circumference do not increase much. So if we have gone through the lecture 1, we have discussed that the pattern of the growth is a cephalocaudal. So if you have not gone through that lecture, I suggest that please go through that lecture. The link is in the description box as well as in the I button. So how does this increase? If you take the head circumference, how does it's going to get increase? Between 0 to 3 months, it is 2 centimeter per month. Between 3 to 6 months, it is 1 centimeter per month. Last 6 months of 1 year, 0.5, then 0.2 per month, and then it will be 1 centimeter per year. So how do we are going to remember it? First 3 months of the life, 2 centimeter per month. 3 to 6 months, 1 centimeter per month. 6 to 12 months, 0.5. So 2, 1 and 0.5. Then 1 to 3 year, 0.2 centimeter per month. After that, only 1 centimeter per year. So question number 14. Question number 14 is, the rate of increase in the head circumference in the first 3 months is A 2 centimeter per month, B 1 centimeter per month, C 0.5 centimeter per month, or it is 0.25 centimeter per month. I suggest please write in the comment box or in the copy. So How does the brain grow? This already has been discussed, and we have also solved one MCQ on it. If you have not gone through it, I suggest please go through series 1 and MCQ keys. By 1 year, 72% of the adult size, and by 3 year, 90% of the adult size is achieved. So question number 15, 90% of the brain growth is achieved by A, second year, B, third year, C, fifth year, or it is a B, D, 12th year. We have discussed height, weight, head circumference. Now we are going to learn about mid-arm circumference. If you see the mid-arm circumference, if it is a less than 12.5, the child is suffering from the severe PEM, and it will be red. If the child is having a mid-arm circumference between 12.5 to 13.5, it is a moderate PEM and it is yellow. And if it is more than 13.5 centimeter, it is normal. The 12th year. We have now learned how does the weight, height as well as the head circumference increase in the childhood. Now we are going to learn how does the mid-arm circumference behave. So for mid-arm circumference, only one thing you have to remember, that less than 12.5 is severe PEM, 12.5 to 13.5 moderate PEM, and more than 13.5 it's normal. It is only measured up to the 5 year. Previously it is considered as age independent, but nowadays it is not considered as age independent criteria. Question number 16, in anthropometric measurement which does not show change in 1 to 4 year. So which parameter does not change between 1 to 4 year? Your options are A, mid-arm circumference, B, skin fold thickness, C, chest circumference to head circumference ratio, or it is D, height. Now the last is chest circumference. How does we are going to measure it? It is very simple. We have to measure it with the non-stretchable measuring tape at the level of nipple, midway between the expiration and inhalation. This three thing only has to be remembered. One thing, at the time of birth, the HC is bigger than the chest circumference. So HC is bigger than the chest circumference. But at the 1 year, it becomes equal. At 1 year, the both thing is equal. But anyway, after the 1 year, the HC will be lower than the chest circumference. It means chest circumference will be bigger. That is adult proportion. So after the 1 year, HC is lesser than the chest circumference. These three things you need to remember. So in a healthy child, your question number 17, in a healthy child, head and chest circumference equals each other around at the age of, your options are 3 to 6 months, B 6 to 9 months, C 9 to 12 months, or it is D 12 to 15 months. Now growth charts. See, our brain works at the best when we have a graphical presentation. You take it a growth, height, weight, head circumference, or take it a share market. If you know the share market, there the growth is always in the form of chart, and there the candle will be there, and upcoming growth and the growth which is increase trend will always please you. So whenever you are having a child with a good growth, and if you see the curve rising up, you will be pleased to see the growth of that child. So what is growth charts? Those are the graphical presentation of anthropometric parameters, and there are vast majority of the information in reference to this topic, but I have taken only these three things because I have seen that you must know that how this kind of growth charts are derived. So if you see the history, it started with the 1977. At that time we were having an NCHS chart, that is National Center for Health and Statistics. This chart were developed with the help of data collected from the US children. Okay. In 2000 we have a CDC, that is Center for Disease Control and Prevention. These charts were also developed with the help of US children, but these children were fed with the formula. Okay, this has to be remembered. But in 2006, there was a development of the WHO growth chart. Here few things has to be remembered, so please pay attention over here. This chart is community based. It is called MGRS, Multicentric Growth Reference Study. It was conducted in the 6 countries across the world, which include India also, Brazil, Oman, Norway, Ghana, US and India. These 6 countries participated in these studies, and these children, make sure, if you remember 2000 chart, children were formula fed. But if you remember this thing, these children were on breastfeeding, receive adequate nutrition as well as good medical care. So 2000 chart were based for MGRS. It was 6 countries and those children were breastfed, receive good nutrition and good medical care. So up to 5 years we have this kind of the chart: weight for age, weight for height, HC, Midarm circumference and skin fold thickness for the age. But after the 5 years we have a weight for age as well as height for age, and one more addition is BMI for age. If you see the chart, I have taken a few charts you should know that how does this kind of charts are looking, and we have to just plot the weight. These are the weight and these are the age. According to the age we have to plot the chart and we have to see where it is coming. Those are different charts for boys and girls. These are length for height chart for boys and girls different. These are again head circumference chart for boys and girls, it's different. This is BMI chart. It is for birth to 5 years. Again we can have chart between 5 to 19 years also. And there are tables also available that you can put your value according to this table, and we have to see which centile it is following. It is 3rd centile, 95th or 97th centile. So the last question of the series 2, question number 18. All are unique feature of the growth charts 2006 except, here it is except, and it is which chart? 2006. Our options are A, breastfed infants as a normative growth model, B, samples collected from 6 states of US, C, includes new indicators such as skin fold thickness, or it is D, reiterates children grow similarly across the globe. So that concludes growth series 2. I hope you all understood and learnt well. Now you will be able to solve the MCQ in no time. If you are still new to my channel, please do subscribe and like this video and stay connected with me, because lot is going to happen. We will have an upcoming video on the solution of these MCQ keys. Stay connected till that time. Take care of yourself. Study smart and study hard. Bye.